Doctors on Call. I'm Grant Boxleitner. Our topics today are the Oriental Medicine manual therapies of Tui Na and cupping. And we're joined by Dr. Stephen Wrench and Dr. Courtney Connell of East West College of Natural Medicine. Gentlemen, welcome. So I want to start with, what is Tui Na?
Well, Tui Na is the Chinese therapeutic massage. It literally means pushing and grasping. Tui, pushing, na, grasping. And so it's the therapeutic massage techniques that are used medically in Chinese medicine.
All right.
It's probably the oldest type of manipulative, say that 3 times, manipulative therapy on the planet. So it's got about a 5,000-year track record. Naturally, when we hurt, what do? We always touch it. We address the area. And so certainly that's been going on for a long time, and the Chinese have an excellent system in place for that.
So stimulating the area via Tui Na. Now, what makes this different from the other types of manual therapies that you've talked about?
Well, Tui Na in and of itself is a complete system of medicine in China. While we hear it today attached more readily to acupuncture and oriental medical therapies, in China it pretty much stands on its own in many cases. So as it follows the principles of acupuncture and so on, it's not uncommon for you to go see a Tui Na specialist, and that's all they do for you.
So as far as Tui Na, if you get a treatment, is this something that could last anywhere from 20 minutes to longer?
Well, it's you mean the duration
like
of the treatment itself?
Yeah, the actual, depending, I guess, what type of, maybe you're got a sore back or something?
Well, Tui Na is not, when most of us think about getting a massage, we think about, wow, I'm going to be on the table an hour and it's going to be great, or, or half an hour, 45 minutes. Usually that's a bit lengthy for a Tui Na session, where we're specifically addressing a problem area that you have. So maybe we'll say anywhere from, say, 10 minutes to 20 minutes might be a
10 to 20, is that?
Yeah, well, sometimes up to 40 or 50, depending on, let's say, how many sequences I string together, right?
So like if it's a first-time patient, is there a chance that it could go longer than if someone has been there for treatments before, or does it just depend?
Well, if someone has a shoulder injury and I'm just treating the shoulder, 10 minutes, 15 minutes, but I could do an entire body. I could do an upper back, a lower back, incorporate some leg work as well, and that would take about 40 minutes.
So in China, Tui Na is considered a complete system of the medicine by itself. Is that correct? Can we kind of dive into that?
Well, when we talk about acupuncture, and these two are all inclusive, they kind of go hand in hand. We talk about, and we have in the past, about our bodies mapped, what we call a meridian system. So in some cases, we refer to Tui Na as Chinese meridian massage, Chinese medical massage, Chinese therapeutic massage. But when we have this perfect system in place that we call the meridian system, we address the points, the channels, and even trigger points and such, which is a little bit different than just non-specifically addressing a
And this
part of the body.
meridian system runs throughout your body?
Yeah, it's like we've said in the past, like a little superhighway system that traverses the body longitudinally, and these are little energy pathways. We call them channels or meridians. You can Google Bong Han Kim channels, and you'll get a little more data about that if you want. But it's kind of like we said before, the wiring in the house. And that's where the energy flows through our walls and gets to our appliances and so on.
So where do you drill down to figure out which one of these systems could be blocked, or which area of the body may have an issue?
Well, you get that a couple of ways, right? One by asking the patient what they're there for, how are you, where is the pain, where's the problem, and the other thing by palpation.
Yeah, so in the Tui Na system, we are really concentrating on working the channel system. And with these normal meridians, we also have what are defined as the tendinomuscular meridians. So actually there's a defined pathway of the way the muscles attach throughout the body and go down the arm. And so we'll not only work with the energy meridians, the Tui Na professional will work with the tendinomuscular meridians, and we would push along them. And if we notice pain, nodules, little tight spots in the muscles and in the tendons, then that's diagnostic, and that's how we take care of things.
So can Tui Na be for both the large muscle groups and even the smaller muscles, or does it work better with one or the other?
It works equally well on both, really, because I can take care of things like carpal tunnel and low back pain.
Okay. So what are some of the things that can be treated by this ancient form of massage? I think we addressed a few of them, but literally, you just mentioned carpal tunnel. What are a couple of the others?
Yeah, well, the easiest, we could go from head to toe, right? I can actually treat common colds and headaches, right, with some Tui Na on the neck or the scalp or the face. The face technique is actually really enjoyable, and it can be helpful for a stuffy nose. Shoulders, upper back, neck, lower back, tummy aches, right? They're Twina on the abdomen, Twina for gynecological issues. Constipation.
What about with
sciatica.
athletes, like if a sore arm or something, I don't know, like maybe a pitcher or
Absolutely.
someone
So
who's active?
it's we actually, when you do have a sore spot, you want to rub it. And this is a Twina movement right here, right? The same thing you would do when you have an injury. So any kind of injury, we would have a sequence or a technique for that area.
We hear deep tissue massage. This is different.
Yeah, the movements in Twina are different than what you would get from a therapeutic massage or just an enjoyable massage, like a deep tissue massage. There are plenty. There's Swedish deep tissue. There's all the different brands. But Twina, the actual movements aren't designed where they're intentionally digging in muscles like a deep tissue. We're more like covering areas. And when we do apply deep pressure, it's usually on acupuncture or acupressure points, right? So we're using a different theory behind. So it's very different.
And we're pushing a button in a sense when we work on a specific point. So which you could just call acupressure at this juncture. But when we just apply pressure, there's no need to really drill the point like you would maybe a little bit heavier pressure on a trigger point. It's like pushing on a button on your computer. There's no need to hammer it, right? You push the button and it knows what to do from that point. So
Very interesting. Well, up next, we'll talk more about Twina, so stay with us.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back. Keep up with the teams from across the area.
And I'll be on the sidelines of the Game of the Week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Welcome back. We're talking more about Twina in this segment. And gentlemen, so you mentioned Twina is practiced in China and incorporates the adjustment of spines and joints. Let's talk about this a little bit more and dig down into this concept. Elaborate on that.
Well, it's considered to be kind of the predecessor to what we know as chiropractic in our country. For thousands of years in the villages in the provinces of China, when you had a pain or something, you would go see your Twina practitioner if he was available. And they would literally, joints are moving parts, right? And sometimes they're misaligned or they're out of place or they need a little tweaking. And so you would go to your Twina practitioner and he would make adjustments much like a chiropractor does today, make you feel better.
And basically everyone would have something of these like they'd have a regular doctor or a massage therapist? Or?
In the whole system of Chinese medicine, there's a preponderance or a stress on preventative medicine. So everyone would get Twina as literally preventative medicine and maintaining good health.
So just constantly a maintenance situation.
Absolutely, absolutely. And I think people have learned that about massage in the modern world today. Getting your weekly or bi-monthly massage is overall not only reduces stress, but it increases blood flow. So it's going to help the overall internal organs work. So it really has been embedded in Chinese medicine, not only for its injury recovery, but also as the full picture of human health.
Grant, if I may, we tend to think about this massage as a luxury, and only for people, the wealthy.
You mean in the Western world?
Yeah, I think we do. And in China, as my colleague said, it's a preventative measure in China. And at the college, we have a massage program in place. And so what happens is people come in when they're hurting really bad. It's like we kind of do everything after the fact. But just like Dr. Connell said, Twina, massage, any kind of manual therapy is best used, I think, as a preventative measure as opposed to after the injury or after the pain.
So over at the college, that's the approach that you guys take.
That's what we stress, for sure.
Well, of course, we stress it with our clients, but we live in America, so we generally see people after the pain gets too bad. So once they're my client, we teach them about what preventative medicine is like, and then we can incorporate the Tween-On into their daily care.
Because that's a quality of life issue. If you can prevent some of these conditions, then the better off the patient's going to be, in theory anyway.
Well, the healthier the body is, you know, at the outset, the better chance that these little aches and pains don't occur. Certainly there's going to be mishaps and trauma, but when we can keep the body healthy, like people, professional athletes get regular massage, they get acupuncture, they get chiropractic, they get all kinds of therapies to keep the body strong and healthy. So injuries are rare, and when they happen, they're less detrimental.
So in keeping with that, what other functions then would a Tween-On practitioner also perform?
Well, it's, as we talked about, the manipulation of joints and so on is very common. And so while it's not really practiced so much here, it's within our scope, we leave that to the chiropractors in the United States.
So an elbow joint, a knee joint even, or some of the smaller joints?
Well, pretty
Shoulder
much
joint?
if it's a joint, they adjust it in China, I'll tell you that. And as they do here in chiropractic.
Yeah.
But one of the things that has been going on forever, as we said, especially in ancient times, but even in modern times, Tween-On practitioners were very, very proficient bone setters. So we'll take a guy that takes a spill off the mountain there and he falls off a ledge, breaks a leg. This is the guy that would come and adjust that very meticulously and create a perfect bone set, and then would wrap him up or cast him or whatever they had at their disposal, splint him in that time. And they were very proficient, and they still are in China today at bone setting.
So they do both. That's one of the other things that they would perform. Anything else that the practitioners of Tween-On would potentially perform?
Well, stretching would be a typical one, and you would get that in a normal massage as well. A well-trained massage therapist actually can stretch you out very well. So stretching the joints, actually in knowing the proper stretches, the joints move back in. You kind of sometimes, bones automatically move. It's kind of like a free adjustment sometimes.
So flexibility is key also in maintaining good health.
Absolutely, and
posture.
we're thinking about it as like we're stretching the tendinomuscular meridian, or we're stretching the actual meridian.
Now, here's an interesting question. Is it necessary to disrobe in order to receive one of these Tween-On treatments?
It's actually not. It's so very different. In the Tween-On tradition, there isn't a very rich like oils tradition. It's all actually done with cloth. The reason you need oils is actually because when you put pressure on skin without any kind of lubricant, it'll burn, right? It's just like getting a burn. So we use cloth. So I generally just use a pillowcase, or you could use something the size of a large dinner napkin, a nice quality cloth. You put that over the bare skin, and then you work on the body over the clothing or with a piece of fabric.
Okay, so like even in a neck, you can maybe just pull the shirt down.
Yeah, you can just pull the shirt down. You wouldn't be pushing hard on the neck enough to burn it, but if you were doing a nice, hard, long push on a back, you would definitely want some fabric in between you and the body. You know, that little rug burn you get when you...
Now, is there a time when Tween-On treatments would be contraindicated?
There are certain situations in which we would opt out of a Tween-On treatment. One would be certainly on the elderly who can be fragile, or they're very, very fragile skin, osteoporosis, and areas of severe bruising, or areas of maybe you have a recent fracture or a surgical procedure, certainly on dermatological conditions and the like.
Interesting. Gentlemen, stay right there, because in this next segment, we're going to be talking about the therapy of cupping.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. The therapy of cupping was prominent in the Olympics with swimmer Michael Phelps. But gentlemen, I just want to start in this segment. What is cupping?
Well, cupping is another centuries-old manual therapy that started in China. It's been practiced all across Europe and around the world now for probably the last few hundred years, more recently in the United States. But cupping was discovered by using animal horns, which created a perfect vacuum, introducing a flame inside the hollow horn and placing that against the skin. And what happened, Grant, was when we would have like a suppurating wound or an infected wound, they would use the suction to draw the pus and the infectious material out of the wound. Then they found that it didn't require a wound. You could place it on areas where you were hypertonic or sore or painful areas.
Maybe, for instance, in Phelps' situation, if you're swimming, maybe these muscles tend to get sore.
Oh, I'm sure they do. So, yeah, to his credit, and all those around him during the Olympics, these guys emerged from the pool with all these marks, and America goes, what's that? And half the world went, that's cupping, and the other half didn't know, but now everybody kind of knows about it. So it's been around in the clinic setting. We don't use animal horns anymore. They're not necessary, but we use a clear glass cup, much like this one. Some are smaller, some are larger. And what we'll generally do in our clinic, we'll take a cotton ball, we'll immerse it in alcohol, we'll put it in a hemostat, light it, immerse it into the cup, take it out, create a vacuum, place it on the skin. Now I'm using my hand here.
So the heat, though, doesn't affect the patient at all?
No, it's almost imperceptible. It does warm the cup very minimally. Certainly, if you didn't know what you were doing, you could toast the edges of the cup, and we're very careful. The flame goes into the cup, then it's placed on the skin, generally on the low back, the shoulders, the mid-back, painful areas, and it creates a vacuum, draws the skin up a little bit into the cup, and it has a therapeutic effect.
So as far as the U.S., has cupping been around not for centuries, but rather just in the last few decades, or?
Well, in the Chinese tradition, I mean, acupuncture and Chinese medicine arrived on America's shores in 1971. So the tradition would have been brought with Chinese, but I would bet that immigrants before that had the tradition, whether it be Eastern European immigrants or even Chinese immigrants. It's been part of family medicine, actually, cupping.
We'll have patients in the clinic that'll say they were of European descent, and they'll say, my great-grandmother practiced cupping on my mother, and my mother practiced it on us. So not uncommon to hear that coming from Europe, especially.
And speaking of that, for patients, what are some of the things that could be treated with cupping?
Well, probably first and foremost it's pain, because who doesn't have pain somewhere? So when we think about that, we usually see what 80% of all Americans are going to have in their lifetime, back pain. And then, we're not getting out of here without it at some point. So that's probably something we see a great deal of, and so it's very, very, very effective in that realm.
So
but there's a lot of
back pain, shoulder pain?
Back pain, shoulder pain, even elbow pain. But also, interestingly enough, I also use it for the common cold. In this upper back area, this is what Grandma used to use it for. Cup that upper back area when you're starting to get a fever. Actually can help you recover from the cold faster.
How long does the glass stay on the body for a cupping treatment?
Well, generally we would leave the cups in place probably anywhere from as little as 5 minutes to maybe 15 minutes. Now, sometimes the cups are placed and they're left stationary. We just leave the patient there, right? Check on them every few minutes, keep them, it's very comfortable, it's not uncomfortable. The other thing that we would do is in some cases we do what's called sliding cupping, where we'll use a liniment on the skin, particularly on the back, and the cups will be drawn up and back across the surface of the skin when we want to traverse a specific or large area.
Now we see that some of the marks that these cups leave, is this something that's painful? Like a day or two later, is it like a bruise?
Well, it is a bruise, really, because it's basically, I like to call it stuck blood that might have been in the middle of the muscle. It's kind of like there's a hidden bruise inside.
Is it a ruptured capillary?
Not at all. It's just bringing some blood to this just below the surface of the skin, right? That actually hadn't been moving through the muscle. It was kind of stuck in the muscle. Bring it to the surface, and at that level, the body can easily wash it away. So yes, there's sometimes marks, sometimes there are no marks, depending on
the person?
Depending on the injury.
And where on the body, are there areas that are more prone to bruising than others?
Well, I would say the back is probably going to show more evidence of that because the tissue on the back, the skin's an inch thick on the human back, and the musculature is much greater there. It's very thick usually on most people, so you're going to draw a certain amount of blood up. We look at a cupping treatment. If we don't see a little bit of discoloration, it's almost like we don't feel it was a successful treatment.
Now, if, like, let's say runners or something, I'm just trying to think of legs like quadriceps or potentially hamstrings. Have you ever given a cupping treatment to something like that?
Oh yeah, I did it last week, I believe. Actually did a full cupping session on someoone's quad because actually a weightlifter.
Oh, so maybe like
post-workout, yeah, they just doing a
leg day.
Exactly.
And they get sore.
Exactly, and so that soreness is, it's lactic acid stuck in the muscle is really scientifically what it is. But if we can do anything to speed up the washing away of that, right, which the cupping will do by drawing it closer to the surface, and the body will just naturally carry it away.
Now, when would you not perform cupping on a patient? Would there be a situation where we better not do this?
We first and foremost, and this is kind of a no-brainer, Grant, but we don't do cupping on the abdomens, and in many cases on the low backs of pregnant women. We don't do it over broken skin with skin lesions around sores and surgical incisions and the like. But pretty much in China, it's not uncommon to have it just about anywhere. I think we see it more in muscle groups and the back especially.
Stay with us because when we come back, we're going to do some demonstrations in our final segment.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back. Keep up with the teams from across the area.
And I'll be on the sidelines of the game of the week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Welcome back to Local Doctors on Call. In this segment, we're going to be doing some demos, gentlemen. But first, I want to get to a couple more questions. Are either of these manual therapies, Tweenon cupping, used together with other therapies?
Oh, absolutely.
Or even acupuncture?
Very often, all these therapeutic methods are combined in one treatment. Not every practitioner does a lot of Tweenon. I personally do a lot of Tweenon. I know practitioners. Some practitioners just use needles and acupuncture. Almost all practitioners will use cupping when it's necessary, right? And then also do acupuncture at the same time, because we can have cups along the lower back, and then we can put in some distal needles, like say maybe somewhere here on the leg, that will assist what the cups are doing. So we combine all the time.
So for some patient, all three of those
absolutely
techniques could be used in one session.
Absolutely, right? So a little Tweenon to loosen up the muscular system right at the beginning, right? And then you can follow that up with some cupping and needling and let them rest for about 20 minutes. And then remove the needles in the cups, and they're pain-free.
So as far as the acupuncture and the cupping, is that a similar duration in terms of leaving the cups on?
That really varies per person.
Okay.
So we kind of come in, check on the cups, and make sure that, that nothing out of the ordinary is happening with them, and remove them when they're finished.
Now, are there other types of manipulative therapy that can be used with traditional Oriental medicine?
Well, there's one other one that we should mention today, and it's called gua sha, and literally it means to scrape toxins or to move toxins through the body. So it's a very, very mild form, what we might call myofascial release. Chinese moms do it on their kids during cold and flu season. And then what they'll do is, we've all eaten in a Chinese restaurant where we have the little ceramic spoon. And because those are readily accessible, we actually use those, or even a small, specially made little device that's got a smooth edge. Sometimes they're jade, sometimes they're hard plastic. Some Chinese moms use a coin, but we take, or a smooth stone, and we'll usually use a liniment on the body. For example, let's say if you woke up in the morning and your neck was stiff and you couldn't turn your head. It's not uncommon to work the muscles around the neck with this very mild scraping motion, and we work in the direction that the muscle fibers
just for a few minutes?
Yeah, a few minutes, and with a nice liniment and a little bit of stretching and movement and manipulation of just range of motion. Generally, that frees up what we would call, say, torticollis, or like a frozen neck. So it can be used for a number of things, though.
That can provide some relief. Very interesting. All right, Dr. Connell and Dr. Wrench, let's do some demonstrations with cupping and Twee-Na. We'll kind of have you guys show us a little bit of what we've been talking about today.
Absolutely. So what we do today is I'm going to use Dr. Connell's forearm, which probably I normally wouldn't. I'd be doing something, a shoulder, a back, maybe on a leg, but we'll do that. Now the types of cups that we talked about, Mr. Phelps, the marks he had on him at the Olympics, more than likely
probably something like that.
Yeah, and this is just kind of a little pistol grip device. It's a little suction device. We attach it to the cup, and I'm going to use.
Now you would heat it up initially if we were really doing it, or not this technique.
This type would not be heated.
Okay.
Because we create a vacuum via suction, whereas we create a vacuum with negative pressure, and by burning up the oxygen in the cup with the fire cupping. So I'm going to place this on his forearm firmly. Give it a little pressure and pump, and if you can get a close-up, you'll see the skin is being drawn up into the cup a little bit. Now I'm not going to go too far, but I want you to be able to see that we would draw that up. Now this may cause that cup to release, but we'll do a threesome here. We'll put one there, and we'll go up a little bit on this one.
And the size of the cup just all depends on the treatment?
Yeah, and the area of the body to be treated, and I really don't want to do any more than this. Are you holding up there?
Oh yeah, feels
okay.
Good.
So we're going to just do a little bit so you can see them attached, and I think we lost suction on the first one.
And for a patient, they would just leave it on there, be resting.
That's correct. Now these would be released, but I have a little valve when you just release the suction by way of the valve, and we take it off. Now they haven't been on long enough, but normally we'd have kind of some little purplish purpura.
And the bruising that you were talking about earlier would appear there the next day, or even right after you take it off?
It's generally within seconds of applying the cups. If there's a lot of what we call stagnation, the blood that's really trapped in the deeper layers of the muscle, and it's not really moving like we want it, it'll get very purplish.
Now we're running out of time, but briefly, maybe some Twee-Na. What would happen in a quick Twee-Na treatment?
Well, for instance, like I could sort of demonstrate on his shoulder just a little bit here. Basically look at this whole area of the shoulder, and I understand where the meridians are, and I might just work it just like a regular massage, right? But then
so the thumb would be mostly the pressure?
Well, there's like, this would be a grasping technique, right? And we talked about pushing, right? It's a bit of an odd angle for me, but I could push as well. But then I would trace the meridian with some acupressure. So just like we would incorporate this into the treatment.
Now, when you talked about the cloth and the other things, at this point you'd be using that?
I would be using the cloth, right, even with the acupressure. And we have one really unique technique which you don't see in the regular massage. We have like a rolling technique where we'll use our hand like this and we'll roll across the muscle very.
So just the side of the hand?
Yeah, just the side of the hand. I can use the side of my arm. It's a bit of an odd positioning, but like we go like this, I can use my elbow. We have all those different techniques. There's about 9 very specific movements that we teach, and then of course we can combine those two to upwards of like 25, like very specifically chosen movements.
And you have an hour to cut that out too, by the way. Felt pretty good. Loosen me up there.
Gentlemen, great show, and that does it for this edition of Local Doctors on Call. We'll see you next time.